Shall I start, ma'am?
Yes. Starting.
Good afternoon, ma'am. And my dear friends, today I'm going to present the first biopharmaceuticals and pharmacokinetic class on the topic Unit 5 application of pharmacokinetics. Under this topic, we will be discussing about modified release drug product, targeted drug delivery system, biotechnological products. Me myself, Yuvraj Regmi from Karnataka College of Pharmacy, second semester, and today I'm delivering under the guidance of Mrs. Rasmi Matthews. Let's go through the contents. Next slide.
Yes.
These are the topic we will be covering today: modified release drug product, targeted drug delivery system, biotechnological products, pharmacokinetic and pharmacodynamic relationship, and drug interaction. First of all, modified release drug product. The term modified release drug product is used to describe products that alters the timing and or rate of release of drug substance in the formulation. Modified release products are generally formulated to alter the timing or the rate of release or to control the release of therapeutic agent from the formulation. A modified release dosage form is a formulation in which the drug release characteristics of time, course, and locations are even locations can also be altered in can be changed in modified release drug product are chosen to accomplish therapeutic or convenience objectives which are not offered by conventional doses. From this modified release drug product offers in alteration in timing or location or rate of release, which was not previously can be achieved by the conventional dosage forms. Next slide, please. The objective of modified release drug product for oral administration is to control the release the therapeutic agents and thus control drug absorption from gastrointestinal tract. Yes, the main purpose for the modified release drug product is to control the therapeutic agent which is absorbed in the gastrointestinal tract. Modified release drug products are designed for different routes of administration based on physicochemical, pharmacodynamic, and pharmacokinetic property of the drug and on the properties of material used in the dosage form. By considering the physicochemical, pharmacodynamic, and pharmacokinetic property of drug as well as the carrier used for the formulation of modified release formulation, all these parameters or all these criteria are considered. Here in this table we can see modified drug delivery products. There are different routes of administration where the modified drug release products are formulated. These are the example in oral drug products: extended release, delayed release, delayed or targeted drug release, orally disintegrating tablet. In extended release drug product, we have already different kinds of formulations which consist of diltiazem, hydrochloride. In delayed release, diclofenac, mesalamine, delayed release, epiprazole. In transdermal drug delivery through transdermally, we have transdermal therapeutic system which consists of clonidine. Similarly, ophthalmic drug delivery, parenteral drug delivery, targeted drug delivery. There are numbers of formulations which have been modified from conventional dosage form so that the release of therapeutic agents or by altering the timing or by bypassing the physiological or enzymatic barrier, these modified drug release products have been marketed. Next slide. There are several types of modified release oral dosage product. We have in previous slide also we have discussed. Some of these are extended release drug products, delayed release products, orally disintegrating products, targeted release drug product. Especially when we come to modified release drug product, it is typically we are typically thinking about only the controlled release, prolonged release, or extended release. But modified drug release, modified drug product also consists of orally disintegrating agent. If we alter the formulation and increase the therapeutic efficacy of the drug, then it is also considered as a modified release. Next slide. Next slide, please. Extended release drug products in a dose form that allows at least a two-fold reduction in the dosing frequency as compared to the drug presented as an immediate release or conventional dosage form. Extended release drug products offers in the reduction of two-fold in the dosing frequency. Yes, in extended release drug products, now the frequency of administration of therapeutic dosage form will be less. Some of the extended release drug products in dosage form include control release, sustained release, long-acting drug product. These all category of formulation comes over extended release drug products. Next slide. Delayed release drug product, a dosage form that releases a discrete portion of drug at a time other than the promptly released after administration. An initial portion may be released promptly after administration. Enteric-coated dosage forms are common delayed release product. Example, enteric-coated aspirin and other NSAID. These delayed release drug products are especially for the purpose of bypassing the gastrointestinal, the stomach GI pH, which degrades the therapeutic agent. So delayed release helps to bypass and increase the therapeutic efficacy or therapeutic efficacy of a formulation. Targeted release drug product, a dosage form that release drug at or near the intended physiological site of action. Targeted release dosage forms may have either immediate or extended release characteristics. Targeted release drug products are also modified drug products which are especially intended to release the therapeutic agent at the particular physiologic site or the particular cells. And this targeted release can be either of immediate, whereby the formulation releases it therapeutic agent, or it may be extended, or the release of the therapeutic agent can be increased and it may exhibit a longer duration of action. Orally disintegrating tablet, ODTs have been developed to disintegrate rapidly in the saliva after oral administration. ODT may be used with without the addition of water. The drug is dispersed in saliva and swallowed with little or no water. These orally disintegrating tablets are also modified release drug product which have been modified so that during the administration there is no need of water, or they are oral mouth. This type of dosage form, especially the patient compliance with this type of formulations is highly accepted by the patients, and they can help this type of tablets or formulation helps in the patient which have problem in swallowing also. Modified release oral drug. What are the dosage forms that are available in modified release drug product? New and novel drug delivery systems are being developed to alter the drug release profile, which in turn results in a unique plasma drug concentration versus time profile and pharmacodynamic effect. Due to the proliferation of this modified release dosage form, the following terms are generally used to describe modified release drug products. Due to the development of various drug delivery system, and by altering the release profile, this modified term drug modified release term has been coined. And in this modified release, the drug, especially we are getting a unique drug plasma concentration, which helps in decreasing or reducing the therapeutic the quantity of therapeutic agent, and by increasing the therapeutic efficacy. Next slide. Enteric coated tablet. Enteric coated tablets are the especially such type of tablets which are coated by a polymer which bypasses the gastric stomach gastric pH, very pH of 2 to 3 pH, and which finally gets dissolved in the alkaline pH in the small intestine. Previous slide also we have mentioned that the enteric coated aspirin, pantoprazole, such type of formulations are designed or formulated in enteric coated tablet. Next slide, please. Repeat action tablet. It is a type of modified release drug product that is designed to release one dose of drug initially, followed by a second or more doses of drug at later time. It provides the required dose initially and maintains or repeats its desired interval. The repeat action tablets, such as prolonged, sustained, delayed, and time release dosage forms, may generally be considered as having the property of prolonged action. In repeat action tablets, one dose initially it will release one dose of drug, and then simultaneously second or more doses of drug will be released after some time, and maintains the therapeutic level in the drug plasma. Next slide. Prolonged action drug product. The prolonged release of the drug prevents very rapid absorption of the drug, which could result in extremely high peak plasma drug concentration. A prolonged action product, except that the peak is delayed differently. A prolonged action tablet typically results in peak and trough drug level in the body. The product release drug without matching the rate of drug elimination, resulting in uneven plasma drug level in the body. A prolonged action drug product also helps to maintain the drug plasma concentration, but in prolonged action drug, the level of the concentration of the drug will be a bit different. There will be no zero order release of drug. There will be some of crest and trough in the drug in the release of drug. It will because it also helps in rapid absorption of the drug. The rapid absorption of the drug will also be reduced, but due to this there will be a high peak plasma concentration. Next slide, please. Sustained release drug product is designed to release a drug at a predetermined rate for the constant drug concentration maintaining during a specific period of time. Usually the drug may be delivered in an initial therapeutic dose followed by a slower or constant release. Sustained release helps to design, or it is designed in such a way that the release of therapeutic drug is in predetermined rate. Means the rate of the release is predetermined, and it will release the therapeutic agent in a constant rate. Sustained release is also formulated in such a way that after the administration, initially it will release some of the therapeutic drug, which will help to increase, which leads to the faster onset of action, and finally it will maintain the therapeutic dose in a therapeutic window. Now, biopharmaceutics factor. What are the rate of absorption and the pharmacodynamic effects of the formulations will be affected by the various biopharmaceutical factors. Some of the factors which affects the therapeutic efficacy or the absorption, distribution. There are some of the factors which will affect the formation in among them. Stomach is also one of the factor which play a very vital role during the absorption of the drug, or the stability, or the stability and stability of the drug are also affected in the stomach. The stomach, especially the muscular hollow dilated part of the digestive system located on the left side of the upper abdomen, where when we administer the drug. Previous slide, please. The stomach receives the stomach receives the food or liquid from the esophagus and stores in the stomach, where the protein where it secretes protein digestive enzymes called protease and strong acid to aid in the food digestion. In the stomach, there is a secretion of enzymes and acids which helps in digestion. The food intake can influence the rate of drug release from the dosage form, the rate of drug absorption, the amount of drug absorbed, and all of these parameters simultaneously. The rate of drug release of various extended release formulation can be affected by the composition of the co-administered meal. The effect may result in positive or negative effect due to the presence of the food, either maybe in solid or liquid form, will definitely have a positive or negative effect on the formulation or the absorption. The effect may be positive or negative. In positive effect, the positive effect means food effects usually comes with drug release speeding up from the extended release formulation, which may cause high risk for the patient at extreme cases by tablet coating erosion. The solubilization effect by bile micelles in the presence of food may have the positive effect on the drug absorption. Due to the presence of food, the gastric the acid we may show the corrosion on the formulation, and there will be the chance of high absorption, or the solubilization effect may also cause the drug absorption, while the negative food effects may take effect on opposite direction by increasing the viscosity of the upper GI tract, delay the absorption rate, and prolong the passage time of the extended release drug product in the GI. Yes, the transit time of the formulation may be extended due to the presence of the food, and so the negative effect. Small intestine and transit time. The small intestine is about 10 to 14 feet in length. Times increase in surface area. Due to its length, it provides a tremendous chance or possibility to for the absorption of drug in the surface. The surface of the small intestine is covered by folds, villi, and microvilli. There are a number of microvilli which helps in the absorption of drugs. Almost 6 to 10 times greater blood flow than the stomach. Yes, the small as compared to the stomach, the small intestine consists of greater blood flow, which also helps in absorption of the drug. Most drug remain unionized, hence major site of absorption for most of the drug. Slow peristaltic movement and high permeability. The movement of the drug, the movement of the food and drug from the small intestine is also slow. Therefore, it gets benefited, and the chances of being absorbed is relatively high in small intestine. The small intestinal transit time of a solid preparation has been concluded to be 3 hours, yes, and 95% of the population. Yes, the small intestine offers a better site for the measure of the drug for absorption. Next slide, please. Large intestine. The large intestine is about 4 to 5 feet long without the presence of villi. Instead of there is a large surface area, but there is the lack of villi, which aids in the absorption. Due to the absence of this villi, there is the absorption of drug is comparatively less than the small intestine. pH neutral or slightly alkaline. A little fluid in the colon and the drug transit is low. Due to the presence of fluid, the drug transit is very slow. Long residence time might help in absorption of poorly soluble drug. Large intestine provides a better uh, absorption chances for poorly soluble drug. Although unabsorbed drugs that reaches in this region may be better by bacteria, as there is a presence of large flora of bacteria in the large intestine. If the drug passed through the large intestine, this drug will be metabolized by these bacteria, and the bioavailability and absorption as well as the bioavailability will be low. Drugs are absorbed rapidly when administered as rectal preparation. Instead of formulating a drug uh, which will be released in the large intestine, it is better to formulate the drug through the rectal route, which may exhibit higher bioavailability. Next slide. Kinetics of extended release dosage form. The amount of drug required in an extended release dosage form to provide a sustained drug level in the body is determined by the pharmacokinetics of the drug, the desired therapeutic level of the drug, and the intended duration of action. Uh, the amount of for the formulation for the designing of the extended release dosage form, the amount of drug is required to provide the sustain or to maintain the therapeutic level for a prolonged period of time. Uh, the pharmacokinetics of the drug is studied to get the derived therapeutic level in this formula. D total is equals to di plus dm, where D total is equals to total dose required. Di is initial dose required. Dm is the sum of maintenance dose. Total dose required means the amount of drug which is needed for the initial release of the drug, and DM is the sum of maintenance drug, means after the release of initial dose, the extended release drug products needs the maintenance drug, which will help to maintain the constant therapeutic level. DM is released over a period of time and is equal to the product of TD, means the duration of drug release and the zero order rate. Yes, the extended release drug products should release the therapeutic agent at a zero order rate, K R 0 mg per hour. Therefore, the above equation can also be written as D total is equals to Di plus K naught R TD. Next slide. However, the maintenance dose is released after DI has produced a blood level equal to the therapeutic level. DM starts, or maintenance dose starts to release at time T. After the maintenance dose is released, DI has produced DI has produced a blood level equal to the therapeutic drug level. The maintenance dose also starts to release at time 0. For drug following one compartment model, rate of elimination are needed to maintain the drug at a therapeutic level. CP is given by the equation, and this equation also can be written as elimination is equals to a therapeutic level into clearance of drug. Here clearance of here therapeutic here shared the clearance of drug in designing an extended release product. Initial dose would be the loading dose that would raise the drug concentration in the body to a therapeutic level CP, and thus to maintain the therapeutic dose level in the body to therapeutic level, the dose needed to be will be is given by the equation D total is equals to Di plus CP into clearance of drug, CT into dosing interval at T. The sign T is the dosing interval. While designing the extended release drug product by using this formula, where Di is the loading dose, where when the extended drug formulation is administered, the loading dose will be increased, which will be released, which will exert its it will maintains the therapeutic level, and followed by the maintenance dose. For many sustained release drug products, there is no built-in loading dose. Some of the sustained release formulation does not contain the initial loading dose. Therefore, DI will be the zero, and the dose needed to maintain the therapeutic concentration for hours for long-lasting therapeutic efficacy is given by the equation T total is equals to Cp into CLT into T, where T is the dosing interval. Next slide. Next slide, please.
Right, time सक्यो यसपछि को गर्ने?
Evaluation of modified release drug products. In vitro, in vivo